Good evening. Welcome to the February 22nd, 2022 Education and Pupil Services Committee in-person and virtual meeting. Before we call tonight's meeting to order, Dr. McGarry, will you please outline the public participation procedures, please, sir?
Yes, Board President Brown and everyone who's with us in person and those who are with us virtually. During the pandemic, the board obviously moved toward virtual participation in committee meetings and board meetings so we can continue to conduct business. The board has updated its policies and is now allowing for not only virtual participation and phoning in comments or questions, we also have obviously returned back to in-person. First, I'll start with in-person. Those who are with us in person tonight are committee meetings, so following each agenda item, the board will have conversations back and forth with the administration. Before the board moves forward, at the conclusion of each agenda this evening, they will allow public comment. Anybody who's in person can come forward, speak to a specific agenda item, and tonight will be a Q&A, a kind of a back and forth, whereas regular board meetings are comment only. Please provide your name and your address and the specific agenda item you'd like to comment on or question, and the board will look to provide answers or look to administration to provide answers where the board cannot provide those answers. So anyone who's in attendance tonight, you will go first. Anyone who's virtual, who has provided virtual comments, either an email of comments or questions or phoning them in, will go after all in-person comments or questions are heard. We are allowing people to phone in comments or questions to 610-789-7200, extension 2000. Please provide your name, your email address, and the specific, again, agenda item for which report you'd like to comment on. The board will take that into consideration prior to moving forward for a possible vote or action at a follow-up board meeting. If you'd like to email your comments or questions in, you can send them to committee questions at upperdarby.sd.org. Again, you can phone it in or you can send an email, committeequestions@upperdarby.sd.org. Please provide your name, address, and the specific agenda report you'd like to comment on, and the board will listen to that and provide answers where possible. I can certainly provide an update at a later point if need be.
Thank you, Dr. McGarry. Please feel free to remind people about that when we do the Finance and Operations Committee meeting. The meeting of the Education and Pupil Services Committee will please come to order. Roll call, Board Secretary, Mr. Rogers, please.
Dr. Haig,
Present.
Mr. Desnoyers,
Present.
Mr. Neal,
Present.
Mr. Warsavage,
Present.
Ms. Lamar Murphy,
Present.
Ms. Williams,
Present.
Ms. Mitchell,
Present.
Mr. Fields,
Present.
Mr. Brown.
Present. Thank you, Mr. Rogers. The district posted this evening's agenda to board docs at least 24 hours prior to the commencement of this meeting. Is there a motion to approve that previously posted agenda?
So moved.
Second.
Thank you. The agenda has been moved and seconded. Are there any amendments to offer?
No, Board President Brown.
Thank you. The agenda has been moved and seconded. All those in favor, please say aye.
Aye.
Those opposed, please signify by saying aye opposed and state your name for the record. Those abstaining, please signify by saying I abstain and state your name for the record. The motion carries. I will now turn over the Education and Pupil Services Committee agenda to co-chair Mrs. Williams. Thank you.
Thank you. Mrs. Kelly, Mr. Marshallek, please begin with an overview of your agenda items for this evening.
Yep, thank you. So tonight we have 3 agenda items, the first of which is informational, which is a review of our health and safety plan. We'll go through some updated metrics, current metrics with COVID data, updated medical information for medical professionals, and also our recommendation to shift from masking required to masks recommended heading into the month of March. Agenda number 2 is board action, adoption of textbooks, world language, French. Ms. Kania will present a recommendation to approve a French textbook for the world language program here in our secondary schools in the district, beginning with next school year, 22-23 school year. And last also is board action. It's policies. Mr. Desnoyers will talk about Policy 101, mission statement and vision statement, and shared values. And again, it was up for a first reading in our last board meeting, and will be up for a second reading in the March voting meeting as well. That's all we have. If it's okay, Ms. Williams, I'll continue with agenda item number 1.
Please, thank you.
Okay, so tonight we're going to talk about our COVID-19 update to our health and safety plan and kind of where we are, with COVID-19. Believe it or not, we're heading into year 3 of the pandemic and how COVID has changed the landscape of our schools over the past couple of years. We want to take tonight's opportunity to talk about what we have in place so far, we have been putting in place in terms of our mitigation strategies and steps to keep our staff and students safe, such as our testing program, good hygiene habits, teaching them in our school, and also having everyone monitor their symptoms daily. And when they feel sick, they stay home from school. We also want to talk about tonight about shifting from masking being a requirement in our schools to now being a recommendation. So we mask recommended effective March 7th, 2022. Before we get moving with that and get into that last piece there, we're going to talk about some of the data we see currently right now with our COVID data. So up here on the screen, I put a couple different comparisons to where we were coming out of the winter break and also where we are right now. So if you look at the first metric point up there, which is incidence rate in Delaware County, if you recall, right around January was one of the highest points in the county when the Omicron variant was really rapidly spreading. We were about 1,245.5 per 100,000 residents for an incident rate. Fast forward to the week ending this past Friday, the most recent data released, it's now down to 73.9 per 100,000. So you can see the rapid decrease in the data. Whether or not it's perfectly accurate or not, we can still see the sharp decrease over the past month from January to February, which is a good sign. The next metric is our percent positivity rate in Delaware County. Again, week ending January 14th, it was 36.4% of tests coming back positive, which is a very, very high number. And now we're down to 6.5%, which is significantly lower from where it was. All good signs. Also, as a comparison in our district, looking back on December 23rd, which is probably our highest point here in the school district with current cases of positive cases in our schools, we had 19 staff and students just on December 23rd test positive in our schools. Looking back in the month of February, up until last Friday, we only had 12. So over the course of one day as a comparison, when the Omicron variant was kind of starting to come out and really being causing problems for people in this area, versus right now, we're seeing a sharp decrease in our current positive case, and we're still maintaining our testing program of testing symptomatic students and staff within our schools. So again, all good signs. You can see I linked the source there, which is the PA Department of Health, which is the metrics that we use and have been reviewing this during the pandemic. We reviewed this before in our last presentation, but to bring it back up to speed again, our current vaccination status, staff, we're about almost 100% of those who responded to our survey, which we did in a previous presentation. Our students continue to increase. We're up to about 14% of our student population who's fully vaccinated at this point. There are a number of students who have first dose registered with us, and we continue to ask our families to, if they wish, to present that information to their nurse so we can record it, and we track those numbers on a weekly basis. As a review as well, we have hosted 5 vaccine clinics since last March, or last spring. Most recently, we held one for our youngest students from our 5 to 12-year-old age group with Children's Hospital of Philadelphia. And just to put it out there again, we have a number of places that have the vaccine widely available. Your local pharmacies, including Long Lane Pharmacy, Springfield Pharmacy, who've been reaching out to us about how open they are with our vaccine appointments. Your pediatrician's offices are actively administering vaccines. And also in our community bulletin board, there is an advertisement for a vaccine clinic on February 25th at the Watkins Avenue Senior Center. So if you want more information about that and how to get an appointment or have a walk-up appointment, it is listed on our community bulletin board. But again, emphasis on its vaccines are out there and they're widely available to anyone who would like one. Again, it's a reminder for our families, communication with the schools. Please make sure you continue to use your symptom screener each and every day. If you notice any COVID-like symptoms, please keep your students home and assess them as appropriate. Please notify your school nurse if you still are, remain in close contact with someone or if you are positive. We also want to know, too, if you're comfortable with supplying your nurse with when you have the COVID vaccine first and second dose so we can track our numbers as best we can in the district. And lastly, as I mentioned earlier, we want to make the shift from masking required to masking recommended in our schools, meaning that we're still recommending masking, but it'll be the family's choice if they do not want to wear a mask in our schools. However, on transportation, it still will be required per the CDC rule. Also, students and staff who are COVID positive and they are able to return after their 5-day isolation period still must wear a mask for the next 5 days. Again, this is linked to our Children's Hospital guidance, also the CDC guidance as well, to make sure they are wearing a mask when they still potentially might have some recovering symptoms in our school setting. But again, that's a recommendation for heading to March. I know Dr. McGarry would like to make a comment as well.
Yeah, before we turn this over to the comments with the board, I just wanted to, and I promised the board that would kind of give a rehash. I guess when you're in administration, you kind of understand where you are and you live it every single day and you recognize the decisions that you made in comparison to the members of the public. And obviously, we understand as administrators that there are people on both sides of this conversation. Our district, I think, has taken a very conservative, cautious approach. We remain virtual longer than a lot of school districts because of staffing, because of vaccination rates here locally. We made decisions based on supporting certain staff that were kind of compromised and making sure that we could support and staff our schools appropriately. So coming out of last year, when we all felt that toward the end of last May and June, that there was a decrease, low positivity rates, that we'd be opening school for in-person instruction and we wouldn't have any problems. Those who are new to this board and those who are new in attendance tonight should know that we were concerned last school year in preparation for opening school year for the worst case scenario and the best case scenario. As a result of that planning, we processed through 5 different instructional models with the public and the board, making sure that, God forbid, if we open the school year this year, we be prepared for the worst case and the best case scenario. We made sure that we were avoiding a hybrid as far as half the kids in half the time, alternate schedules, A, B, C, and D. We worked toward meeting people where they were. What do I mean by that? We created a schedule this year where if families didn't feel secure enough to send their students to school, we had a virtual, synchronous, or asynchronous option. Much controversy around that. Some states and some local communities absolutely denied an opportunity for asynchronous or synchronous instruction. The leadership of this board and the administration decided that we wanted to give that optioning for our parents. We also were talking about, as we worked to in-person instruction, at the time this past summer, July, August, really August it started to kick up, we were only really making a decision on masking when it came to students under a certain age, students under the age of 11 and down. Why? At the time, in our communications and our decision-making, we felt that students that were ages 11 and older, if you recall, had enough time and enough availability to get vaccinated. Several months had passed, and we had decided to say that going into the school year, it was going to be masking recommended for students ages 11 and older, and that they had an opportunity, well enough time to get vaccinated, and that was their choice whether they were going to get vaccinated or not vaccinated. I decided in meeting with the board and the public that that decision was not available yet for kids 11 and younger. And so we had decided to go masking before many school districts did with students that were younger than the age 11 because there wasn't a vaccine available. It just so happened at that point in those conversations, the Delta variant came out, there was much more of a concern, and the masking conversation somewhat became a moot point. It was taken out of our hands a little bit because there was conversations how serious it was. There was a lot of students who were coming for in-person instruction to restart the school year because the Delta variant was so serious and there wasn't a vaccine available for younger students. We saw an increase in the number of families opting for virtual, synchronous, and asynchronous instruction. So again, I want to pause on a couple factors. Coming out of last school year, there was much anticipation that we'd be coming back to a normal, typical school year. We planned for the worst case scenario, and thankfully, we were well prepared. In the summer, the shift from the previous variant became the Delta variant. There wasn't a vaccine available for younger students, 11 and younger, and we made a decision to move to a more masking required as the Delta variant increased, worrying about staffing and worrying about a vaccine being available for younger students. Fast forward to where we are today. We've made it very clear that we would continue to be conservative and cautious, much to some of the concerns that people are out there saying that we're just racing for whatever reason to make this decision. We'll probably be one of the later Delaware County school districts to move away from masking required to masking recommended, because as the trends are moving in a direction, we feel by that time we'll definitely be in a very good position to make this decision. But also, I want to reiterate, there has been plenty of time in conversations with medical professionals, in conversations with my colleagues, having run 5 vaccination clinics, having done surveys to get people to sign up to get vaccinated. We've provided a lot of avenues and a lot of opportunity for people to decide if they would like to have their child vaccinated or not have their child vaccinated. We're to a place now where we feel like it's now a decision for you as a parent, you with your children, the vaccine's been available for all of us and to be boosted, that it's best to say we're going to move toward recommended. The data is working in our favor, the vaccine's been widely available, and we feel that by March 7th, it makes the most sense for us to move in that direction. Again, we're not saying masking optional. We're saying we still recommend for families and for staff who feel it's in their best interest to protect themselves a little bit longer or move in that direction. We support that. We are not saying it's as if we are not allowing masking in schools. We still recommend that it happens. We're no longer going to require that and force that as a condition of attending schools here in the school district. I just wanted to make sure that we understand the history was tied to more than just some of the data going back to January or July. It was also tied to vaccination availability, people being educated on that, and our support in trying to help people get to that place. We're now to a point where it's clear that a lot of people are making their own decisions whether they're going to get vaccinated or they're not going to get vaccinated. And as a result, in conversations with other professionals, while we encourage that, can we hold other people back for other people choosing not to get vaccinated? That's where we are. That's why we feel moving to a masking recommended by March the 7th makes the most sense for us as a school district.
Any questions from the board, comments?
I just want to say, I feel very proud of what this district has done in the past 2 years. I think that nobody would claim that we've been perfect, and I'm sure there are, points that anyone could look at and say, here we could have done this differently or done that differently. But I just really, I want to thank Dr. McGarry and Mr. Marshallek and Ms. Kelly and the whole administration. I think you've really all done a tremendous job dealing with very, very limited information, very, very imperfect information. And I think oftentimes the media and sources that people look to state things as if they're much more clear and black and white than they really are. And I'm not a real scientist. I'm a mathematician. We're fake scientists. I'm just kidding. But one of the things we talk about is probability and uncertainty, and dealing with uncertainty is really hard. And so I think it's very tempting to say masks are so important and essential and everyone must be wearing them, or to say masks are an absolute waste and I don't know, and they're bad for our children. And I think most of us would agree that the truth is somewhere in the middle. And while the disease was really spreading very, very rapidly, and there was a great deal of uncertainty as far as how it was affecting everyone, including children, it made perfect sense to be going virtual and then to have mask requirements. And now that we have more information and we have vaccination, I think it makes sense to say, okay, we think that parents can make this decision for themselves. We think that the risk overall, well, certainly not zero, is low enough. We've sent children to school during flu season for decades. We send children to school in cars that are extremely dangerous and kill many, many children every year. And we accept that there's some risk inherent in life. And I just really appreciate the subtleties that you all have seen and have worked with. And I think this is, while I understand that it may make many people nervous, I think this is a good decision, and I really appreciate the care that you took in coming to it.
Thank you very much. Appreciate it.
I also wanted to say thank you, Dan, or Superintendent McGarry, for making that clarification about recommended, because I think in some of the communications, it may be hard for parents to understand the word recommended, and we should make sure that they know that it is within their right to mask their child or not mask their child. So I think when the communications go out to say it's within their right, but we are strongly recommending that masks continue.
Sure, we'll add some more clarification to that. Normally, we're going to have a district home and school meeting coming up as well, and clarify that, and I'll certainly pass that along.
I'm not going to repeat any of the great points that Director Dr. Haig made, but I do want to add that it's not an exact science. There's people that have been critical of the decisions we've made, and now that we're going to masking recommended, other people are going to be just as hard and critical of us, saying you shouldn't have done that. So, there's arguments to go both ways, and nobody's exactly wrong. I mean, you have a right to feel the way you feel, but I have to give credit to Dr. McGarry and the entire team, because it's clear in the results that we've been one step ahead of the game every time. Districts that are, half our size and one-third our size have had to shut down due to outbreaks because of a lack of planning or a lack of foresight, and we've never had to do that. So I think that's proof there that the plan has worked, and that we are following the science, we are following the guidance, and we're making the best decisions. And I always think about every decision that we make about every topic, not just masking. Someone's going to be unhappy with us. That's the nature of the game. That's the nature of the business that we're in. That's what all of us signed up for. But we do the best we can with the information that we have, and we follow our minds and our hearts. And I make decisions that affect my child and my children as well as everyone else's. So I'm comfortable with that. Thank you.
I just wanted to say thank you to all the administration, the teachers, the staff, and the students for dealing with this. Is a very difficult situation that all of us have had to face. Nobody knew what all the answers were, and I think that the patience that people have had has been extraordinary. And, we're all in this together. So that's really all I wanted to say. We are in this together, and we're going to get through this together. It's all, hopefully we're on a better path going forward. And I appreciate the care that we've taken in this situation. So thank you.
100% agree with everyone's statements that were made so far. My concern is a little bit more recent, is that we do have a health and safety plan, and that plan was not implemented during a recent visit of Governor Wolf. And I was wondering if the administration could speak to that.
Sure. In those conversations with Governor Wolf's office and the team that were here, it was part of the conversation with them that they felt that there was screening that took place, vaccination and boosted people were in play, and that the people that were in the room were vaccinated, boosted, and were not symptomatic or had already been tested to be okay. So Governor Wolf felt it was okay only during the actual speaking portion, or when they were getting ready to speak, to be unmasked. Otherwise, people in the room were masked.
Thank you. So it was basically a decision made by those people individually in that bubble, because I did see some social media posts of photos, and photos can get taken out of context. So that's why I wanted you to explain a little bit more about the decision-making that happened prior to that meeting.
Yeah, it's similar to the press conference I was a part of this past week in the police office that I was a part of. There's, locally you'll see also, presidents of the United States and others will also speak in that moment, that they know that they're safe, they know that they're screened. The masking is really, for all intents and purposes, here in the school district. I see the sign. I'm well aware of the social media posts. Board member Neal, I think that the reality is that I'm vaccinated, I'm boosted, and the governor was vaccinated and boosted, and the other adults in the room were vaccinated. I think that's a key part of that conversation. The reason why we're wearing masks throughout the schools at that time was positivity rates were really accelerating, and we had a very low vaccination status in our school population. If we were allowing people to walk around the building and the facilities, I can tell you right now that they would have been masked, and that would not have been the case. We also had, as the chairs are set up right now, we had distancing in the room when people were there, and anybody who was not speaking or if they were getting ready to speak, they were masked at that time. Again, listen, I thought about this when I went to take my mask off and speak at that point. Hindsight's 20/20. I take responsibility for, maybe keeping my mask on, even though I've been vaccinated and boosted. But I think the intention was that there was a closed environment and this was not around other students, and we wanted to make sure we got the message about funding our schools across appropriately. So there's always going to be criticism. I take responsibility for that, and I'm not going to hide from it. I definitely took my mask off to speak, and I'm willing to take the heat for that.
Thank you, Dr. McGarry. I know that was a tough question, but your answer was definitely reasonable. Thank you.
Director Neal, I'm myself and many other school board members attended the press conference. There was at no time that anyone was unmasked, that they were within 6 feet of anyone who was masked. The only person who was, without the mask was someone at the podium. I know every day our students eat lunch in the spaces that we have, and they aren't within 6 feet, and they are unmasked when they do eat. So there are instances in the school day where students do not have their masks on. I'm sort of a conservative when it comes to the masking, and I was comfortable in the room. I have been known to leave rooms when when people didn't have masks on. So I felt like, the appropriate measures were taken, and at no point did the speaker was anywhere within 6 feet of someone else.
I appreciate that, Director Mitchell. As you know, I was not here. I just wanted to get more clarification and make sure that those answers, those really honestly reasonable answers that you both provided were on the record so the public knew. Thank you.
I just want to add to Director Murphy's point, strongly recommended. It's like a recipe, right? You don't have to add salt and pepper, right? It's recommended. The meal tastes a lot better when you do, right? It's like, it's along those lines. The school functions a lot better. We can guarantee the moment, Dr. McGarry, that we have to shut a school down because a lot of people are sick. We possibly might go back to, I don't want to speak for the administration, we possibly might have to go back to making masks mandatory again. We want to avoid that, right? So everybody do the best they can. That's all we can do here. Like Director Mitchell, on this issue, I'm probably the most conservative about the masks. But I trust this administration. I trust our staff, and I trust the families in this community to do the right thing. And I'm very hopeful. I'm very hopeful. But like Director Murphy said, strongly recommended. Add a little bit of salt and pepper to that steak. It tastes a lot better.
I just want to reiterate again to Board Member Neal's questions and the comments that are going around the room. And I know in moments like this, we do want to add some levity to very serious situations. And I know all the board members feel this is serious, and I appreciate the support, and I understand the comments, Board Member Fields. And I just want to say to everybody, it has been a team effort. I think we're one of the few school districts that I know of up until recently where we've been able to have a very patient, calm, understanding discussion back and forth on this. I received some strongly worded comments today against this decision. I know that there are some folks with us who feel that it's not happening fast enough. But I definitely think the leadership of our building principals, this board, having the strength to allow the administration to make decisions and not try to micromanage every step along the way, I think the public needs to understand the board does not have a job paid to run the school district every single day. You volunteer, you're elected, but you volunteer your time, and you're trusting us to make very serious decisions. And I think throughout this period of time, coming out of winter break, a large school district like Upper Darby, we stayed open. We stayed open because of the decisions we made as a team, because of the planning that we had as a team. We did not shut down, and there were days where we were struggling. But I think it's a compliment to the teachers, the nurses, the social workers, everybody, the principals in this school district and this board having the courage to allow us to weather that storm, to get to where we are. I think the mental health implications now where we are right now are just as significant as some of the other factors that we're facing. And we're trying to work our way to try to get back to as what is normal as possible. And so I just want to say to the board, give yourselves credit too. There are a lot of times when these issues come up that the natural tendency is to own it and handle it yourself and not trust the people you've put in place to lead these things. And I want to say thank you for your trust in us and the team to allow us to process through this and make these decisions, which has not been easy. And I think that's served us well over the last couple months as a community. I think that's been great. And I want to say thank you to Rhonda Buford and to the cabinet. We've had 50 or more, I don't know how many communications and several public virtual meetings, including every time we've made a decision, we've met with our entire faculty, letting them know why we're doing. So I think one thing we've learned from this pandemic is there's plenty of time to communicate appropriately with people and to get it right. And I think that's been a godsend to us. So thank you.
I want to make one more point to Dan's points. Upper Darby staying open when we came back from winter break. I can think of at least 2 school districts with twice the budget and a third of the kids that had it shut down for at least a week, maybe longer, right? And our doors were open. And, okay, I think it's a round of applause. Okay, oh, that was really half-hearted. I'm kind of disappointed, but that's okay. Right, not a lot of people in the room. But I think that speaks to what we've been trying to do here and the successes we've had. So thank you.
Any other comments from board members, questions from board members? Okay. We're going to go over agenda item number 2, please.
Okay, someone of Ms. Kane, you come on up. Again, she'll be presenting tonight for board, excuse me, for board action, adoption of a textbook for French.
Good evening, Dr. McGarry, Board President Brown, board members, and the Upper Darby community. We find ourselves in need of new French curriculum. The previous curriculum we used was from HMH, Houghton Mifflin Harcourt. They informed us last year that they would no longer be producing French curriculum. So we knew going into our search that they would stop. What we didn't know is that our big 4 publishers, McGraw-Hill, Pearson, National Geographic, Cengage, also either didn't start publishing French world languages or stopped. We had to use our team of French teachers to reach out to their colleagues in different districts to find out what publishers they were using. Vista became one of the most highly recommended publishers. Highlights of Vista's curriculum are listed above, based in ACTFL standards, cross-cultural content. It's very diverse. The publication date is actually 2023. We will have it for September. Vocabulary is presented in meaningful context. In other words, not just lists. There are authentic activities and readings. I'll go into that in a little bit when I talk about the internet, the digital licenses. It builds interpretive, interpersonal, and presentational communication skills, which are critical in a foreign language. Virtual video chats, again, I'll expand on that in a second. Grammar activities that are scaffolded and personalized, and of course, beautiful color illustrations, and a spiraling, targeted, consistent review. As far as the digital licenses, when we looked at both textbooks, both Wayside and Vista, their textbooks were pretty on par with each other. The teachers called it a tie. What broke the tie was the digital license of Vista, because it was so much more interactive for our students. It could be self-directed. It had virtual video chats. So a French speaker in a Francophone country, which is a country, could be the Caribbean, Canada, France, Europe, a French speaker from that country asked a pre-recorded question or questions. Students open that up and then they answer in conversational French. So it exposes them to French in different countries, different cultures, and expands their speaking abilities. Also, once a month, they put authentic news clips, age-appropriate, I should say, age-appropriate news clips, newspaper stories, and short films for the students to watch. So they're fully immersed in the language. If you look on the right side of the screen, Vista is in 80-plus school districts in Pennsylvania. I listed a few that are relatively close to us: Council Rock, Springfield, Springford, Radnor, Lower Merion, and then quite a few private academies as well. The cost is $62,895, which will give us a class set of textbooks in one class set in each middle school, because we only have one French teacher, no matter how many classes cycle through her room. 3 would be in the high school, so we have 3 high school classrooms set up for French. And then French 2, 3, and 4 are high school only, and they will have, French 4 will have 1, French 3 will have 2 classrooms, and French 2 will have 3 classrooms. Another benefit of Vista was their digital licenses. They will give us a pool of 250 digital licenses, and we can draw from them as we see fit. So next year, we might need 100 French 1. The following year, we might need 75 French 1. We can draw whatever we need. Wayside, we had to buy them per level. So we had to guess what we were going to need over the next 6 years in French 1, French 2, etc. That was a drawback. They also offer 2 3-hour teacher PD sessions, but they told me that they would break that down into 6 1-hours, whatever worked for our district. And then there are 70-plus free PD webinars already archived on the site, so our teachers are already accessing them to get ready for next year. Questions?
So I have a question. If my memory serves me correctly, you and Ms. Kelly presented the world language curriculum alignment of French and Spanish at our November meeting last year, right?
Correct.
Is the recommended adoption of this textbook tonight a continuation and extension of that research?
It is an extension of that, yes.
Okay. Thank you.
You're welcome.
Is the digital licenses able to grow past the 250? I just feel like that's kind of low. And like, is every child getting automatic access to the digital copy so they don't have to lug home a book, every night?
The 250 licenses, Director Neal, you're probably forgetting that the high school is semester courses, right? So it sounds like a little, but they're only using them for half the year, and then we recycle that license for the second half of the year. So we definitely have a buffer built into that number.
Okay, thank you.
I thought of something else. I'm sorry.
That's
You
okay.
mentioned one set of textbooks because we have one French teacher, correct?
At each middle school, correct?
At each middle school. If we, and I know they're hard to come by, Dr. McGarry educated me as far as French teachers, hard to find. If we did have another French teacher, would we purchase another set? I mean, would we grow
It would depend upon if we were having 2 classes simultaneously. We could have another French teacher that maybe taught French and Spanish, and we could alter the classes that we still only need at one classroom. It would have to be like a case-by-case basis.
Okay.
But it really wouldn't be that hard to reach out and get another 35 textbooks.
Thank you very much.
I want to put this out there because I know it was a conversation that we had prior to getting. There's a lot of work that gets to this moment. I know a lot of during the committee meeting agenda, some board members asked some important questions, and this is not really a question to you, Kathy, or to Ed or to Christine, but I know there are a few companies because there's a much more of a push to some kind of a virtual environment, and we know that still requires a teacher to be in the classroom. So it's very complicated just to say we're going to move away from a textbook. You still need a teacher in the room as somebody is delivering some kind of an online portion because you can't have students alone in a classroom learning a foreign language virtually. The other part of that I want to say is, as Board President Brown asked this question, if anybody is listening and they know another language and they have a college degree and they're willing to come in to be a teacher of a foreign language, and we're talking about we'd be willing to expand to other foreign languages, not just traditionally French or Spanish. We have Mandarin here at the high school too. It would be wonderful if we could tap into local community resources. If there are individuals who speak another language, have a college degree, we'd be willing to bring you on as an emergency certification and expose our kids to learning another language as an opportunity similar to the question. We are, as a board and the public should know, we are struggling to fill foreign language teachers. We did look into as some kind of an online learning option. It is way more expensive than what we're going through right now. But to Board President Brown's question, I do think we should keep our eye on the fact that learning foreign languages moving forward, unless there are more people going to school to be teachers of a foreign language, I do see us looking to explore those online type of virtual learning opportunities moving forward. But anybody who does speak or very fluent in another language, we would be willing to have a conversation about adding that to our curriculum as well moving forward as an elective for students.
Any other questions from the board? We can move on to agenda item number 3.
Okay, our last item for tonight, I'll turn to Mr. Desnoyers to go through our policy for this month.
Thank you. There's one policy under consideration this evening. It is Policy 101, the district's mission statement, vision, and shared values. As a reminder, the changes that are being considered this evening, in order to take effect, need to be moved forward by the board this evening and approved by the board at a subsequent board meeting. So the updates to Policy 101 are as follows. The district's new mission statement and vision are being incorporated into policy. The new mission statement and vision were developed with community input during the process of creating and adopting the 2021 to 2024 Upper Darby School District Comprehensive Plan. After being posted and available for public comment for 28 days, the plan was adopted by the board at its August 10th, 2021 board meeting. Thank you. That concludes my comments.
I have a quick comment. In the summary, in the policy summary, it mentioned that the comprehensive plan was utilized in order to, this was born out of the comprehensive planning work. So, and it said that community, input was sought after. Was it the people that was assigned to the community members that was assigned to the comprehensive planning committee, or was the wider community reached out to in order to provide input?
Sure. If you recall, I am a member of the study councils group at Penn Graduate School of Education. I get an opportunity to meet with superintendents from the Commonwealth, New Jersey, and Delaware. In that, we had a training one day on what is called a portrait of a graduate. And it's hard to remember, but we started that conversation here at a public meeting. We surveyed faculty, we surveyed community, and we also did that as part of the beginning stages of the work. Now, there was a pause because the pandemic hit, but we did gather this information with the board in a conversation with our work on using the language in the portrait of a graduate, where there were vocabulary words and definitions that we were working on, surveying and collecting that information, even to our faculty on a wide breadth of getting that information. If you recall, when this was presented to the public before it was board approved in a couple presentations, in the meeting itself, we also highlighted those portrait of a graduate words that we agreed upon through the comprehensive planning process in the presentation. I think it was in purple and gold. They stood out in the actual presentation, gathering that input, explaining to people at public forums, in surveys, and then through the process, gathering that information with staff and the public.
Thank you, Dr. McGarry. I do remember that now. You jogged my memory on that, so thank you very much. And I do like the proposed mission statement.
At this time, are there any public comments?
Savanja Lozine, 1144 Myrtlewood Avenue. I just have a few questions. I know the district is really pushing for, high vaccination percentages, but I emailed Dr. McGarry today just to clarify the number of staff, professional staff, and support staff. The 97% of the 798 who responded, that doesn't look right to me. If you include the total number of staff, I think it's around 2,200. Is that correct?
No, so let me actually go through all your
Okay,
your comments.
so if you, do that math, the percentage of total vaccinated support staff and professional staff is about 35%. So that's an accurate representation. And that right there, I know you guys really are pushing for vaccinations and masking, but that's science speaking, and the numbers dropping because in Mr. Pipitone's biology class how one, it was a 10th grade, that what happens when you let your body fight infection and they create antibodies is natural immunity. That's what it's called. So, and plus, as parents, we've been put in different situations that, the vaccine has been mandated for us, but when it comes to our children, they don't have any conditions, related to maintaining their career. So we're a little bit more, protective of that. So that's why that number is really low. And you're right, we have had the chance 3 months to make a determination, but, like I said 2 weeks ago, that number is really not going to increase. And I actually was kind of shocked at how low it was. Also, just to clarify, if I go out to State and Lansdowne to catch a bus, it's a SEPTA bus, not a school bus. So school buses are not public transportation. Masking is not required on school buses. The last bullet point, I just want to clarify, regardless of vaccination status, students and staff who return, are you imposing a mandatory 5-day quarantine? Is that's what I'm interpreting? Okay. And just a few questions from the community. How are you guys going to deal with, teachers who are fearful of unmasked students? Because it's, kind of occurring now and almost like bullying with peers. The cafeteria situation. I know that, it's just unfortunate how these children are sitting, and that's the only time they get to see their peers is during cafeteria or recess. And they're sitting like caged animals to me. The contract that was just ratified, the 5-year, is there any stipulation or clause in there that says that there's a remote or virtual option for the teachers? And also, due to the other surrounding school districts that, I'm aware of, is there an ADA clause for reasonable accommodations so we don't end up in federal court like Springfield? That's it. Thank you.
I guess I'll begin with the end in mind. Yes, we have a new teacher contract, congratulations, and we are one of the first, and I'm proud of us that we've negotiated into our contract in good faith that there will be 3 learning options moving forward, as I said earlier, for students. So that is part of our process moving forward. Students will have an opportunity, so will teachers, to benefit from using all 3 learning models in our
Did
teacher's
you say there was
contract.
5 initially when this school year started?
I'm sorry?
Did you say there was 5 learning options?
No, we went through 5 options,
Okay.
processing through like in-person only,
So now we're
in-person
down
and
to 3.
asynchronous. So no, I'm sorry, let me start over.
Okay.
Earlier tonight, I explained that this board reviewed 5 different types of options for in-person, virtual, and asynchronous learning, a combination of factors.
Right.
There are only 3 really learning models. Asynchronous work, which is work given to you online and you do it on your own.
100%
Okay.
asynchronous.
Right?
Okay.
In-person instruction, where you come in every single day and you
100%.
attend classes.
Okay.
And then we have 100% synchronous work, where you're logging into your classes live. Those are the 3 learning models that will be available moving forward here in the school district.
Okay.
That's answer to one of your questions.
Mm-hmm.
Yes to ADA, of course. Part of that conversation with ADA, and we'll certainly talk about that too. We will meet with special education students, 504 families, to work out the accommodations that are necessary for special education students and those requirements. We would do that normally, and that would be worked out through a 504 or an IEP meeting. I'm not trying to be a wise guy, but I'm unaware of cages in the schools.
I mean, they look like that, though.
So I think students are in desks lined up appropriately so we can have in-person instruction
Do you
because
sit like that at lunch, Dr. McGarry?
I don't really eat lunch, to be honest with you.
Well,
That's
whenever you
fact.
have a meal.
I wish during the
Okay.
week that would be.
I know it
would
doesn't
be
look like that.
an option. But in order, I've said this since day one, and I let you go, so if I can get through these, that would be great.
Absolutely.
Okay. That students are sitting facing one direction and spread out as much as we could within reason so that we could avoid having half days, A, B, C, D cycles of students coming in. And so in order to keep our schools open and meet some of the requirements, we have students in desks as close to 3 feet as possible facing in one direction, simply to keep our schools open and do our part with what Dr. Haig explained, we learned would allow us to keep our schools open. But referring to it as caged animals, to me, is offensive. And I just want to make sure that we're clear that we don't consider kids animals or have cages in schools. Fearful unmasked students, of course, we're going to have teachers who feel fearful. We've already heard from some teachers, and we'll work with those teachers on that. But we've also made it clear that we're not going to require students whose parents on March the 7th decide that masking is strongly recommended. But if you decide not, as you are tonight, not having your child wear a mask in school, that we're going to work with those teachers and provide them the appropriate protections. But we're not going to push that on to the students that come into the classrooms. We will make the appropriate ADA accommodations for everybody within reason. But we're not going to force a child to wear a mask on March the 7th. Mandating quarantine. I think this is, again, an honest answer to a question. I think you're coming at it from a different approach. There is an honor code system. I'm only going to know if your child is sick if you tell us if they've tested positive, right? So we're asking people to be respectful that if over the weekend your child is sick, they're going to be out for 5 days. If you tell us that they're COVID positive, which we would hope that people would still do because we don't want to put anybody else at risk, that they would mask the 5 days they return. If you test positive in school because you're symptomatic,
Right.
you're out for 5 days, we will be asking you to wear a mask for the next 5 days, given the recent guidance. I don't want to get into an argument about that tonight, but I guess my answer to you is yes, we will be mandatorily requiring 5 days more of masking if you are positive and you want to return to school on day 6. School buses and transportation, school buses are considered public transportation, and we can agree to disagree, that's fine.
They're not.
And all schools have been advised legally and from the Pennsylvania Department of Education that we are to require masking still on school buses. I don't know if any of us are forcing anybody to be vaccinated. Your data, I think this is the adage, liars figure, figures lie. What the slide said specifically was, of the people who responded to our survey, we do not get great survey results. Of the 738 people, we have well over 1,000 employees. But of the 798 people who did willingly respond, which is a pretty high response rate for staff, 97% of those who responded are vaccinated. We would guess that it could be that same number all the way through the system. We don't know. To go out there and say only 35% of our staff is vaccinated, I don't think is accurate. I think they're the folks who had enough time to fill out a survey with everything else that we have going on. I
Well,
think
you
that's
could-
everything that you had.
You can assume that the people that have not responded are not
I would.
vaccinated.
That's a dangerous
And
way to
if
live your
you,
life, I think, to make those
use
assumptions.
the 2,200 as the, bottom line, as a common denominator.
I think we got to be
then.
careful. What I'd like to put out there is what we know for sure. 790 some odd people responded, and 97% of those who responded are vaccinated.
Okay. All right, thank you.
Dr. McGarry, just for clarification purposes, can someone here tell us exactly how many staff we have in the district?
Yeah, Dr. Council will give you the details.
We have 952 professional staff and close to 600 support staff. So close to 1,600 employees total.
Thank you.
Do we have any other public comment at this time?
Our first comment is from Maggie and Vigard Sorby, located at 327 Clearbrook Avenue in Lansdowne. This comment was received on the 22nd at 1:44 p.m. via email regarding agenda item number 1 under Education and Pupil Services. The comment reads, at the December 21st committee meeting, specific targets were shared for a move to mask optional. According to the CDC county tracker, we have not yet met those targets, and the transmission rate remains quote-unquote substantial. Why were the targets adjusted? Also, what stakeholder input have you gathered to supplement the guidance that you have received from CHOP? For example, it would be helpful to hear clear data about broad input from families, school staff, and students. We understand that medical decisions should be driven by medical advice, but given that medical experts differ in their guidance, we believe that stakeholder input to supplement expert guidance is critical. Like everyone, we are eager to move past the point where masks are necessary, but this decline in COVID cases does not indicate that case numbers are low. It simply indicates that they have declined from the record-shattering numbers from the recent wave. Time and again, this pandemic has proven to be unpredictable, and we don't yet know the trajectory of the new BA.2 variant. And a vaccine is not yet available to this community's youngest children, many of whom are siblings of district students. We hope that any decision to change the current plan is done so with meaningful consideration of why the district's targets have changed and data from a widespread effort to understand stakeholders' perspectives. Otherwise, we worry that those most at risk in our home and community will have their health compromised by the political headwinds of this moment. Thank you very much for your time. And this person included some screenshots from data that I can't be sure of the source, so I will not state that data.
Ms. Buford, I responded to this person with some of the updated data, some of the information that was presented today, shared why we were kind of moving in this direction, understood their perspective. I value their input. They clearly do not feel like we should move away from masking right now, and my comment would be, we have done surveys to folks. We do not get great results early in the year. If everyone recalls, we tried to find out who wanted to go virtual, who wanted to go in person. We had a very low response rate from the community deciding what option they were going to pick. I also believe that by going recommended, we were giving the parents the option still to protect their children if they feel it's best. So we're not taking away that opportunity, and we're strongly recommending that those who feel that way can still have 2 or 3 options. They can go virtual, they can have asynchronous, or they can come to school in person and wear a mask.
Thank you, Dr. McGarry. Our next comment is from Ilona Shabani, located at 290 Charles Avenue in Drexel Hill. Comment was received on the 22nd at 6:19 PM via email regarding agenda item number 1 of the Education and Pupil Services Committee meeting agenda. The comment begins, I understand you're informing the public about vaccine clinics and vaccination status. Please stop advertising to the public about vaccines only. Why don't you recommend about eating a healthy, balanced diet, getting enough sunshine, getting enough exercise, getting enough rest and relaxation, and all these matters help in keeping people healthy and not sick. People should hear encouragement from the district about a fully balanced, healthy plan and not just only about vaccines. It seems all we hear in the news lately and throughout mass emails is vaccine statuses and vaccine clinics and when the next one will be hosted. It is very discouraging to see such a push for this topic when there are many other methods people can stay healthy without having to take a vaccine. Healthy kids are the lowest risk of getting COVID. Please do advertise more about other options so people can make a fully informed choice. May I please just add something to that, just as the Director of Communications who handles the parent information nights that I've been tasked with by Dr. McGarry and the School Board of Directors. We do have healthy eating nights, and we have brought in experts to also talk about the mental health of parents and their families. So it is a multi-pronged approach to staying healthy in this district. Thank you for indulging me with that. Our next comment is from Kelly Bowie, located at 709 Central Avenue in Primus. The comment was received on the 22nd at 6:26 PM via voicemail and email regarding Education and Pupil Services Agenda Item Number 1. The comment begins, Ms. Bowie asks for, someone actually wrote down their interaction. Ms. Bowie asks for clarification of the difference between recommended and optional. Did someone address that?
Yeah, I addressed it earlier, but I'll address it again. Optional does, in my opinion, does not seem to add the same level of support from the school district administration and the team that we still believe that we support and strongly encourage parents who feel that they want to protect their students. Optional, I think, on some level, and this is not to disparage anybody who's used that terminology, makes it sound as if we are completely moving away and not taking it still as seriously as we are. So it's really, in some school districts' language, somewhat of a of getting down in the weeds in the terminology, but recommended. We believe we're putting out there that we still think it's an important safety measure for people to consider when they send their students to school.
And our final comment received tonight was from Suzanne Brittis, located at 319 Austin Drive in Clifton Heights. This comment was received on the 22nd, and I don't have a time, but I did see maybe about 10 minutes ago we received it via email through Education and Pupil Services Agenda Item Number 2. The comment is regarding French curriculum agenda item. The comment begins, I used the digital version of Vista to take Spanish through another institution a few years ago and found the program to be a very user-friendly program to use for learning a foreign language. End of comment, and that comment was received at 6:45 PM. Thank you. That concludes comments for this evening.
Thank you. We can move on with the review of the agenda.
Okay, so again, tonight we had three agenda items. Number 1, the health and safety plan, informational only. Number 2, adoption of textbook, world language, French. This is for board action. And of course, number 3, policies is also for board action.
Thank you.
Want to get consensus on the 2?
Yep.
Okay.
Okay, we have 2 items up for board consensus tonight. So the first one is, sorry. hang on. The first one is for our world language. So I'm just going to poll the board. Is that a yes?
Yes.
Yes.
Thank you. And then we have a second item up as well.
Policy.
Hang on, I'm getting there. The second one is for the policy change, and is that going to poll the board? Is that a yes?
Yes.
Yes.
Thank you.
I see Kyle's giving me a look. And I know that some folks are new to the leadership positions, and I take some responsibility. So the people that are here in the public and that are listening virtually, it's consensus to move it forward. The use of the word like a poll vote to the board, there wasn't an official vote. It's a consensus moving it forward. There actually won't be a vote until the next meeting. So just want to make sure that we're clear on it's a consensus moving forward. We're not polling. It's not a poll vote situation. That's all.
Director Williams, I'm going to turn it back
Back
over to me.
to you.
Thank you very much. I appreciate it. A motion is in order for the adjournment of the Education and Pupil Services Committee meeting. Thank you. All those in favor?
Aye.
Aye.
All right, meeting adjourned.